I apologize for all the millennials out there. I know you guys are gonna probably beat me up after this, but I'm gonna talk a little bit more about millennials and how they kind of shape up our own practice, especially when it comes to social media and so forth. So these are my little disclosures. There are no conflicts of interest apart from the fact that I am good friends with Dr. Babar Rao. I don't know if that's a conflict though. All right. So first of all, I mean, we really have to kind of look at all the different types of generations that are out there. And the millennials, as you can see them over here, people who were born from 1981 to 1996. So these are our millennials. Uh, I consider myself a Generation X. I'm a little older than the millennials. And as you can see here, we've got the Generation Z, and the newer ones are also now coming up with like Generation Alpha and so forth. So these are the people who have these very strange vocabulary. So, I mean, I don't know, they talk about skibbity and I don't know, it's not even English. I don't know where that's coming from. But our focus for today is going to be the millennials because these are the ones that we actually see as patients, or at least in my practice. I run a very cosmetic practice, and a lot of them are from that type of generation. So these are the little breakdown on how they are. And you can see here, the millennials actually make up the most when it comes, apart from the baby boomers, they kind of make up the most of the people that we are going to be in terms of population. And at the same time, people who you're probably going to be seeing in your own practice. So who are millennials? First of all, millennials, as I mentioned, they were born in 1981 or 1982. You can see them over here. They make up about 2.3 billion people worldwide, and they have control. They have control of pretty much, when it comes to consumer discretionary purchases in the United States, most of it is actually made up by the millennials. In Latin America, they make up, that's very important for them when it comes to kind of look at their career and so forth. They basically, have that in a sense. 60% of them would probably rather spend more money on experiences than material things. I don't know if that's true or not. I still value kind of, an expensive watch. Apparently, the millennials want to be in Bali somewhere, backpacking. That is completely not me. I don't know, Munib, do you do that? I mean, are you more into the experiences or into like fancy watches? You do both. He can afford it. He's one of the millennials that can afford it. All right. So, what are the characteristics of the millennials? So, if anybody who identifies as a millennial, this is all for you. First of all, they are multitaskers, and you can see, I mean, a lot of them are here. They're listening to my talk, and at the same time, they're on their phone. Okay, I don't know how they do it, but they're able to do it. They're also able to watch TV, and at the same time, they're still also on their phone. Believe it or not, I walk in. I walk into my own practice sometimes, and I see a patient, and the patient is I'm doing a full consultation. And the patient is, on the phone messaging God knows who, and at the same time, they're teleconferencing somebody, but they're very much well known when it comes to multitasking. They're able to juggle all these different responsibilities. However, that being said, they're also very easily distracted. Okay, yeah. So I mean, and you can see that because when you talk to them, if they're, they come in with a certain thing, in my practice, for example, they're focused on their lips. They want to kind of enlarge their lips because they saw somebody who's got a little large lip. They told them, honey, your lips are fine. But, if we do a little bit on your chin, and immediately, also something's wrong with my chin, and they immediately kind of shift focus there, and it's basically their chin that they're worried about right now. So they're easily distracted when that comes to it. They also find social media and texting very hard to resist. And of course, we got all of them over here. Munib, for instance, like, how many followers do you have? 22 million. So it's very hard to resist. Okay, so they're always on their social media and they're texting. It's unbelievable. There was a patient that I saw as I was injecting that patient. The patient was live streaming the injection, and so, I don't know. I told her like you can't do that. She, I don't allow it. She tells me like, hey doc, if you're going to be injecting me, I allow myself. And she signed the consent for her to be actually live streamed, and she did it. It was on her live stream, not even on mine. She did tag me though. I got a couple of followers after that. They're also very tech savvy, and that's the reason why you're all here. I mean, probably half the room here is a millennial. They're very tech savvy. They're interested in digital media. They're interested in AI and so forth. Okay, so they're also very curious. Okay, so they are going, when they come in, they are always going to ask you questions. What are you going to be injecting me with? They know pretty much more than you know. Okay, and now with with Chat GPT, it's opened a whole can of worms, okay? Because they're being fed Chat GPT. So first of all, it used to be Dr. Google. Now it's pretty much Chat GPT that's basically telling them what what they're supposed to be doing. And this is actually very good at, it's got its positives and its negatives. The positive aspect of things is that they make fewer bad decisions when they come in and they describe what they want. You kind of tell them this is, you take them throughout the whole consultation process. They're very happy with it. And, if you basically follow through, they're also very content. So when it comes to their cosmetic and their aesthetic results, they're also very happy because they know what they want. They can tell you exactly how they are. The only thing, there are some individuals, the only thing that's missing is that if you give them the syringe and they'll do it for themselves. Okay, they're really that good when it comes to that area. So they're very curious. However, that being said, they're also very impatient. Okay, they want instant gratification. They want things done to them yesterday. If you tell them their botulinum toxin is not going to be seen, or the effect is not going to be seen until pretty much, 7 days or 10 days, they are going to be unhappy about it. They want instant gratification and recognition. There's a little bit of sense, I apologize for this word, but there's a sense of self-entitlement. Okay, so they want that. Which is different than Generation X. Yeah, we were beat up by our parents, that's for sure. They're a little needy. They want they were basically raised, but from constant praise. Okay, because their parents, they really always praise them apart, which is different than us. See, I feel bad about it. I've got this, a lot of angst because of this, a lot of mental issues. So, but the nice thing about it is they love the collaboration and they love the connection. So when it comes to that, when they come, they love being connected. Every time they're somewhere, they are going to always connect with you. They were going to follow you on your social media handles. If you're a doctor and you've got a social media, they will probably also follow you. So if they kind of they love that effect. Then they will come in and ask you, "Oh, I saw you post something on this. Can you tell me a little bit more about it?" So that's the nice thing about that. So don't be surprised if you get referrals from them, okay? Because they will always do that. They will always refer you because they're always very well connected in that area. They also value transparency. So because they're very well informed, if you are going to try to kind of fool them, okay, it's not going to work. Okay, you have to be very transparent. So if you tell them this procedure is going to take so and so, they will appreciate it, even though they want that instant gratification. It may take a little bit longer period of time, but if you are transparent with them, they're actually going to be more appreciative. So an open and honest communication with the doctor is very important. And they also seek authenticity. So if you do have a social media handle, as all my colleagues were telling you, and just before me, you want to be very genuine, very authentic. Okay, don't be just too commercial, trying to kind of push products or push something there, because they're pretty much savvy in that area, and they will gravitate to a treatment that actually works because they have the knowledge for that. So with them, always keep it real. All right. So, if they come in and they are expecting, for example, a treatment, they want kind of you to tell them about the combination treatments. Don't tell them, hey, listen, and this is the only treatment for you. No, you need to tell them, hey, listen, the reason why you're here, you require, for example, a treatment with an energy-based device, maybe a little bit of an injectable, and then probably give you a little bit of a skincare routine using Remedy. Plugged it in there for you. So that would work for them. So the combination treatments are very good in that sense. If they're very suspicious if you tell them this is the only thing that will work for you, because they know that you're basically lying through your teeth. So there are many famous millennials that I want to talk to you about. The first one, these are little classic examples. Another example that I was told just 2 years ago by Mark Kaufman, the president of the AAD. This was in New Orleans, and Mark comes up to me and he goes like, this is an example of one of the millennials, says he has a daughter. I, I don't know many of you know the story, okay, because it has you involved. And she goes and tells him, and this is like in front of us, she goes and tells him like, hey, listen, I mean, Dad, I met the most famous dermatologist out there. And Mark was like, I'm the president of the AAD. So who is the most famous dermatologist that is out there? And he's right there. He's on the stage, sitting over there. Okay, and she meant Munib. Okay, and I think Mark met him in New Orleans, and they had a little chit chat. But these are your millennials. Okay, so the importance of most famous dermatologists for them may not be, for example, the professor or the president of the academy. Okay, so that's how they tend to work out. I quickly just wanted to kind of talk to you a little bit about Middle Eastern beauty aspirations because that's where I come from and this is where the trends are. Huda Beauty is from the Middle East. She's actually residing in Dubai. For females, Middle Eastern beauty, for when it comes to the millennials, when it comes to any of our patients, the eyebrows are usually raised, very well defined. We love to have our cheeks a little bit full, but not too overfilled. The lips now currently it's more or less 1 to 1. It used to be 1 to 2, but everybody now wants the whole 1 to 1 effect. However, you need to kind of educate them about this. The chin is a little bit more on the pointed side, also a little bit longer, and the jawline should be well defined. For male beauty, of course, botulinum toxin requires to be a little bit more natural, not too frozen. And for the fillers, you can also, you want to avoid injecting the zygoma, avoid injecting, you want to make the chin more on the square side, avoid overcorrection of the eyes for the cheek troughs, because believe it or not, the ladies like to have us look tired. Okay, so if we have dark circles around our eyes, it's completely normal. Okay, so it's completely fine. And for the temples, if they are gaunt, I mean, you want to kind of also fill them up. And for the lips and the forehead, you can also do that too. So our trends for younger patients, for the patient population group in the late 20s or early 30s, these are your millennials, specific what they want. They're very, very specific on exactly what needs to be injected. They will come in. I want my lips done. I want my dark circles taken care of. I want my chin to be defined. It's not like the older generation, they come in and they tell you like, doc, just do whatever it is that you feel that you need to do. No, these guys are very, very specific. They want instant results. And when it comes to pricing, they were always going to try to haggle the prices with you. Okay, so you want to be very clear from the beginning with that. And with this, I'd like to thank you for your kind attention. And I also wanted to kind of remind everybody, if you are a society member, please vote for Dubai as your next destination for the World Congress of Dermatology after Guadalajara in 2027. Thank you so much.